Healthcare.
Welcome back to Mountain News this morning. We're joined here with Dr. Joe Kingery from UK Healthcare. We're talking today about cold and flu. It's about that time now. We're getting into the fall.
Right.
What is the difference between cold and flu?
So that's a great question. A lot of people come in and say, I think I got the flu, or they just say, I've got the flu. So flu and cold are sometimes difficult to tell apart from each other, and also people get it confused as far as, okay, what exactly is flu and cold? So they're both caused by a virus. It's not a bacteria, so antibiotics is not going to do any good in either case. But the cold is cold is a virus that is associated with the upper respiratory tract, and it mostly stays there. It causes runny nose, sneezing, cough, maybe a low-grade temperature, but that's about it. With flu, you get systemic symptoms as well. So you get muscle aches, you get really run down, fatigued, as well as the upper respiratory symptoms. So those are the big differences between the two.
Okay. And can a cold feel like the flu?
It can in some cases, so everybody responds differently. So even though we say that's the way cold works, that's the way flu works, certainly there can be differences in different people. So cold may be quite severe in someone else they're more mild. So it is a little difficult to tell the difference. So anytime you think you might have the flu, the best thing to do is get into the doctor's office, get it checked, because we can do a quick test in the office and determine if it's the flu or if you maybe just got cold or even a sinus infection or something.
Okay, and what are some common treatments of both?
So it's a great question. So for the cold, there's not anything that can actually cure it, unfortunately. It's all supportive care. So it's antihistamines to try to dry up all of the drainage that you have with it, maybe some decongestants, nasal sprays that can help with it, Tylenol or ibuprofen to help out with taking care of any fever or pain you might have. For the flu, there is treatment, which includes antiviral treatment such as Tamiflu, which is a common medication we use. And the big important thing is we like to start that within 48 hours of the time the symptoms start. So again, it goes back to being really important that if you think you might have the flu, get tested so we can really start the therapy soon and try to get you feeling better quicker.
And what are some things parents and teachers can do to kind of prevent the spread?
It's a great question. With both of those, definitely the sneezing and coughing in close proximity to each other does transmit it, and we know that for sure, that you breathe in someone else's respiratory particles when they sneeze or cough. But also there's a thought that touching things that people have sneezed on, coughed on, also can transmit it as well, because as you can imagine, you touch something and then you end up wiping your nose or coughing into your hand where it's touched someone else. Is stuff, and that can cause it as well. So good hand hygiene and washing. If you know someone who's got the flu or cold, trying to keep some distance from them especially. And obviously it comes into play with teachers of, does this child need to be in school or not?
Okay, thank you so much. We'll be right back with Mountain News This Morning.